Now, the Health Minister, Dr. Zweli Mkhize, has said that the COVID-19 vaccination is not going to be compulsory in South Africa. But with around 53% of respondents to a recent poll saying they are willing to have the jab, others obviously not, some are asking whether it might be necessary to make the vaccination mandatory. I want to explore this further with ethics and philosophy academic Jacques Rousseau from the University of Cape Town. Jacques, good afternoon to you and welcome. So around 50% of South Africans are skeptical. I guess that public apprehension for this vaccine, which has been produced at breakneck speed, the concern would be legitimate. Do you agree?
I don't think it would be, but it's legitimate. I think that people might feel concerned. I think that they feel concerned because they've been misinformed, and I think we can understand people's fears about this. The idea of this vaccine being rushed, for example, is a misrepresentation. When the whole world focuses on one problem, things happen quickly, right? But saying it's been rushed creates a different signal. We also didn't have the techniques that we have previously. So it's a misrepresentation, but I think I can understand why people are vaccine resistant, yes.
So some people are vaccine resistant, and we've certainly seen this in the United States of America, claiming that it's an attack on personal liberty.
It is certainly an intrusion upon personal liberty, yes, but that doesn't mean that it's an unjustified one. It's an intrusion on personal liberty when I can't, or when I couldn't buy liquor on Sundays, and now I can't buy it on any day, or when I'm forced to wear a seatbelt and so forth. But intrusions on personal liberties need to be understood in terms of what their purpose is. And in this case, the intrusion in question can save lots of lives. So it is perfectly justified because it comes at no cost or very minimal cost to you as an individual and could end up benefiting a lot of other people.
So how do you then make the case for the vaccine?
You make the case, I think, we live in a time of great polarization and antagonism with regard to opposing viewpoints. So you certainly should not go around belittling people or questioning their fears, as I was trying to make it clear. What you do is you calmly and carefully explain through very well choreographed PR campaigns, which I don't think we're very good at here, at least the state isn't very good at, explaining why there is no reason to be afraid and why people should take this. And also, I think you back that up as ground up, our medical health publication argued today, you back that up with a highly public vaccination of sports stars and politicians and hopefully even Justice Mkhize.
It's beyond just mere messaging, isn't it? Just giving people information doesn't always result, I imagine, in an increased willingness. It's going that extra level, and it's high-profile people that have got to demonstrate the safety, the efficacy, I guess.
We've got to find high-profile people who appeal to all sectors of our population. Somebody who, you can do this with market research, find somebody who speaks to each particular demographic or football club fandom or whatever the case might be. And show people that it can be trusted. But the concern you are citing is real in the sense that this campaign or it can, in a sense, give people opportunity to spread their conspiracy theories and paranoia in response to that too. So some research suggests that it isn't productive to try to promote things in this way, and certainly that it might not be productive to make them compulsory either.
Will the conspiracy theories around something like this always be prevalent?
I think so, and I think that they're only going to get worse, at least for the future that I can foresee. Perhaps we will have some future enlightenment which will, again, make us all more concerned with rational discourse and evidence. But I don't think they're going to go away, and unfortunately they're being amplified more and more through social media and through some very prominent and influential voices on social media. So it is a concern, and I think, again, I'd want to say I can understand it because we don't have a good track record of being able to trust our government. So take on the vaccine issue, for example, with distribution and rollout, we don't have any confidence, we can't have any confidence that a lot more money is going to be diverted or looted in that sort of situation either. So I certainly understand these fears, and we're going to have to work very hard to build public confidence in this process.
And if that is achieved, second phase then, I guess, is dealing with stigma. Either there is stigma if you've had it or you haven't.
Yes, there certainly will be stigma, and of course there'll also be real practical consequences. People must realize that if they don't have it, they might not be able to fly, to travel anywhere, they might not be able to work in certain occupations. And I think the law around that is still slightly unclear as to whether employers can force it. But certainly social stigma But I mean, as we've seen, especially in South Africa's history, with things like racism, people are going to retreat into their bubbles in this case. So if I feel stigmatized, or I mean, I'm obviously going to have the vaccine, but if I were not to and was stigmatized because of that, I would then just retreat further into my little echo chamber or filter bubble of fellow anti-vaccination people and reinforce their views, and they'd reinforce mine. So that will be a big problem.